Hi, my name is Kyah, and today I want to talk to you about certified nursing assistants. As a certified nursing assistant or a CNA, our work is defined by care, compassion, and dedication. We are often the first person a patient encounters in the morning and the last person a patient sees before heading to bed. Today, I want to walk you through what it takes to become a CNA and the responsibilities we carry and the impact we have on healthcare. If you've ever had a loved one stay at a hospital or in a nursing home, chances are that a CNA played a major role in their care. And if you don't know much about CNAs, then this will give you a glimpse into what we do. And I know this because I have been a CNA myself for about 7 years, and I have worked in both healthcare setting or hospital settings and in long-term care facilities. And I have seen firsthand in how we support our patients and the healthcare team. And I've done a little bit of research as well to give you a little more information. To become a CNA, you need to complete a state-provided training program. These are usually offered at a community college or at a local healthcare center. The training includes both classroom and hands-on clinical practice. Then to get certified, you have to pass a state competency exam, and some states require you to do additional credits. With my training, I only did 8 weeks, and I didn't have to do any additional credits. I just did the clinical portion and the classroom portion, and then I went ahead and was able to take my exam. According to a 2023 study from Shanghai Community Health Service Center, gaps in training, especially in areas like nutrition, can have real effects on the quality of care CNAs provide. If there's any gaps in any training that you do, it's going to affect the quality of care you provide for your patients. And with the hospitals, every unit has their own training program and education that you have to take for whatever department that you are working in so that you can give the best care for them. Once you are certified, you jump right into the patient care. CNAs help with things like bathing patients, walking patients, feeding, dressing, and any other basic needs. We also check vital signs for our patients, and if there are any abnormal changes to their vitals, then we report it immediately to the nurse. We work in all kinds of areas. We work in hospital settings, we work in long-term care facilities, and we can also work in patients' homes. Some CNAs can specialize in departments like oncology, med-surg, or geriatric. These things open up more responsibilities and more opportunities for you. And a 2023 study from the National Comprehensive Cancer Institute looked into CNAs onboarding in oncology units, and they found that combining simulations and real-life experiences helped CNAs transition into the roles more successfully. And I think nowadays more departments are doing that, and there are required trainings that you have to do before working on that department, and they will set you up with these trainings, which is great for learning more. When training isn't strong enough, especially in things like nutrition and patient observation, it affects our outcome. And when we get the right training and the support, we improve in patient care in real life measurable ways. Again, back to what I said about the departments having their specific trainings for them. They are really on your side on how they want you to care for the patients, and they will give you the training that you need to give the patient the best care you possibly can. And what people don't always see is that how close CNAs are with their patients, and you are with them all the time, and you are with them through their ups and downs, and you are there to support them. And these things are very meaningful for the patients, and for me, it's very heartwarming to be able to be there for a patient when they're at their lowest and help them through whatever they need. And as the population ages and the demand for skilled CNAs keeps growing, we are essential to making sure that nurses and doctors can do their jobs and the patients get the support that they need. The same 2023 study from Shanghai emphasizes how strengthening CNA's education directly benefits patient and healthcare systems. So today, so far, we have looked at what it takes to become a CNA, the daily responsibilities we take on, and the lasting impact we have on healthcare. And I want to leave you with a little story. One of the most meaningful moments I've had as a CNA was when a patient who just came out of surgery and they couldn't even sit up at first for themselves. Each day, I helped them move a little more, sit up a little more, stand and walk. And at the end of it all, it was slow work, but at the end of it, they were able to get up and walk on their own and walk out of the hospital. And that was very eye-opening and very heartwarming for me. Some CNAs don't just care for patients. We walk them through their weakest moments to their strongest moments. And that's why I do what I do. Thank you.